is no good health without sustained attention to health protection, disease prevention, and health promotion. Central to achieving such good health is the need for our attention to its determinants, including the conditions in which people are born, the conditions in which people live and learn and work and play and even worship. And even more specifically, what we consume as food and enjoy as pastime, such as drugs. Despite man's knowledge, we march along each day like the proverbial blind, ignoring and violating these all-important determinants, punishing our bodies, escalating the level of non-communicable diseases, inflicting harm even on our innocent children in their diet and lack of exercise, causing them to be more obese and even diabetic than any other period in history. So while any responsible society must focus on the curative aspects of health, which is in large measure what this mission is responding to, I have to underscore the point that largely financial and economic gains, in other words, reducing expenditure on healthcare, is derived from the preventative side of the health equation. Your Excellency, Sir S.W. Tapley Seaton, Governor General, Dr. the Honorable Timothy Sylvester Harris, Prime Minister, Senior Minister, the Honorable Vance Whitworth Amory, Minister of Tourism, the Honorable Lindsey Grant, Minister of Public Infrastructure, the Honorable Ian Patches Liebert, our Senator, Mr. Zakila Byron Nisbet, our Minister from Nevis, the Honorable Mrs. Brandy Williams, indeed our Cabinet Secretary, Mrs. Josephine Huggins, Dr. the Right Honorable and Right Excellent Sir Kennedy Alphonse Simmons, who has served the health industry for many years, before politics and after politics. Indeed, His Excellency, the Ambassador of Taiwan, the Honorable Michael Powell, His Excellency Michael Powell, ladies and gentlemen, all honorable ladies and gentlemen, good morning again. I warmly welcome all of you to this important event. I welcome you on behalf of the government and people of St. Kitts and Nevis, and on behalf of the ministry with responsibility for universal health insurance, and on my own personal behalf as well. Today marks a journey towards the formal implementation of universal health insurance, commonly referred to as national health insurance. Today marks the public launch of the Universal Health Insurance Commission, and further, the public signing of a contract between the government of St. Kitts and Nevis and the University of the West Indies Health Economics Unit, as we in St. Kitts and Nevis pursue the mandate of this unity government to extend requisite health care coverage to the wider population. By doing so, we intend to ensure that even the most vulnerable among us can experience the quality health care that everyone deserves. At page 18 of the Team Unity Manifesto, our contract with the people of this federation, we record our commitment in the following terms, and I quote, "It is our belief that the wealth of a nation is the health of a nation. A Team Unity government will, within its first term in office, commission a comprehensive national health insurance plan for all citizens of St. Kitts and Nevis. And I pause to add, all residents as well. In commissioning the plan, partners such as Social Security, employers, and trade unions will participate in working out the best possible benefits of the plan, as well as the level of payroll deductions, if any, and as well as the enrollment of every child in school through their school registration. It is with that mandate in my mind that I approach the task ahead with the determination to engage all stakeholders as we pursue what I will here describe as a fundamental rights issue. Since the turn of the century, the discourse on universal health care for all has accelerated globally. It is therefore no surprise that the United Nations sets out Sustainable Development Goal number 3 in the following terms: ensure healthy lives and promote well-being for all ages. But in fact, if you look at all of the SDGs, a close examination will show their interdependence. All of the SDGs influence health, and indeed health influences all of the SDGs. For example, better health enables children to learn and adults to earn. Gender equality is essential in the achievement of better health. Reducing poverty, hunger, and environmental degradation also positive influences, but also depends on health. That is why, in my opening statement, I drew your attention to the inevitable truth that financial and economic gains, in other words, reducing expenditure on health care, is derived from the preventative side of the healthcare equation. I have traced the increased discourse on universal health in St. Kitts and Nevis all the way back to 1989, when at that time, the concept of universal health coverage was introduced to the government of the day and implemented in 1992 for all public servants. Since that utilitarian approach, I have observed how many public servants seeking medical care benefited from the free medical scheme, especially when seeking major medical services overseas. Now, some may think universal health insurance is not for them because they have insurance of their own at their job. What happens if the job disappears, I will ask? Or if the insurance disappears, then what? No amount of bake sales and raffles can raise sufficient sums to cover the cost of cancer care, which can exceed $1 million just for cancer treatment. And when you're forced to walk the streets with a sponsor sheet, seeking contributions, some well-to-do persons equally scoffs at you. Well, although what we're doing here today leads to the elimination of sponsor sheets seeking contributions to finance medical care, I really cannot move forward without directing attention of selfish persons to 1 John 3 and verse 17, where it says, if anyone has the world's goods and sees his brother in need, yet closes his heart against him, how does God's love abide in him? You see, my friends, hemodialysis in this federation costs $125,000 per year. What if the private insurance decides you are a bad risk and cancels your coverage? Then what? Lack of health insurance is a real nightmare being faced by real people. Naturally, when reality hits, people turn to the government. Which government treasury can be the medical ATM for all people? It always tugs at my heart when I think of poor Livingston Griffin from Keys Village, a young man at 34 who had an operation, a successful one, at the hospital here. And then he was told, you have to seek 21 cycles of chemotherapy in Trinidad and Tobago for a cost of over $30,000 US. Poor Livingston Griffin, an ordinary fisherman. He couldn't go to fish while he was sick. And I saw that young man suffer a very painful death at age 34, just because he could not access health care. And then at 31, young Akila Dore, a person who was working for the public service, had not properly enrolled because of something. 31 and stricken with cancer. And have to travel to Antigua, to that center there. And I recall when she called me on the phone and said, Minister, I have to come back home. They're not doing any work on me because I don't have it. $9,000 US. And I had to call the principals of that institution and say, you have to treat that lady, even if I have to raise the money myself here in St. Kitts. In the audience here today, we have young Deontay Foster, a young man who at 21 started feeling pain. He's a little slow apparently, and when he went to the Olympics in 2010, to those Olympics, he brought home 2 gold medals, yet at 21, he found the pain in his foot, diagnosed as cancer. He's standing there on one leg. Can you stand, let them see you? Standing there on one leg after his leg had to be amputated. And you know what? I admire him because Livingston brought home 2 gold medals, and today on one leg, when he went back to the Olympics in 2015, I think, he found pain and could not continue. And I understand that now he is trying to get a prosthetic leg. And I know those of you who have contacts, let us help Livingston to get a prosthetic leg. I don't know how national insurance will help him, but I trust that we can give some assistance to national insurance as well. And then, of course, I was in hospital on Sunday visiting. And there was a 29-year-old young man. His kidneys are gone. He needs the hemodialysis every day, perhaps for the rest of his life. And he doesn't have it. I looked at the poor mother sitting in the hospital, weeping away, and thought, all of us have to help. 29 and his kidneys are gone. Well, just reflecting upon such cases leads me to also reflect on the teachings of our Lord Jesus Christ in the gospel. He emphasizes the importance of alleviating the suffering of people. Throughout his ministry, Jesus himself healed the sick and suffering. The blind, lame, the hemorrhaging, and the lepers all found relief in the healing powers of Jesus. He gave the 12 disciples, which is reported in Matthew 10:1, the power to drive out demons and heal every disease and sickness. The ideas of helping and providing for others is constant throughout Scripture. But I'm not preaching. The government, of which I'm a part, places a very high premium on adequate social protection in all its forms that will be of benefit, particularly to the vulnerable, those who, but for the efforts of a caring government, would be left to struggle hopelessly and perhaps helplessly to fend for themselves against all odds. When I think of persons who suffered because of lack of resources, I harken back to 1992 and I say, God bless the imaginative minds of 1992 that brought unprecedented relief to ordinary public servants. And I say further, that it is the imaginative minds of the present-day administration with broad public support that would again take healthcare delivery to another level 26 years later. The Commission's work is expected to be about a process of hard and honest reflection. Reflection of the best way to ensure all have access to high quality, affordable health care that they need when they need it. People should not have to delay a needed procedure because they have no money. People should not suffer the humiliation of their savings and pension wiped out by medical bills. Foregoing a needed prescription drug or procedure because of lack of funds is troubling. People becoming bankrupt or disabled, or people dying for lack of funds is problematic and inhumane. The time has come, therefore, to make some decisions about the design elements of our universal health insurance program. Now, from what I've said so far, I hope you don't think that I'm promoting sickness care or sickness insurance program. Far from it. While the curative patient care has its place and is a major component of our health policy, I really want universal health care to incorporate rigorous health promotion to positively impact lifestyle choices in terms of food and drink we consume, the exercise and meditation we embrace, and an overall preventative regime of wellness initiatives, including pap smears, mammograms, colonoscopy, and prostate screening before one even gets sick. This, of course, can help to reduce the expenditure for individual families and for the broader nation. I also want us to aspire to an equal, fair, and reasonable set of fees for service as we grow our healthcare infrastructure, delivering surgical, medical, mental, and other services to the people of this federation. The Commission, therefore, is charged with the responsibility to deliver a proposal to the people of this federation that will guarantee access to high-quality care for all, that will promote wellness and support preventative care, that would help us achieve efficiency in healthcare delivery, that would reduce the cost of healthcare services per capita. A proposal, ladies and gentlemen, that captures the imaginative endeavors of the government and people of this federation, a proposal of which we all can be proud. Before I go further, I want to tell you I have a very good friend in the audience. His name is Mickey Weintraub, who runs an organization he describes as Mickey's Hope. Single-handedly, Mickey assists hundreds of persons across the entire federation. But in healthcare alone, cancer patient number 1, Mickey is out there trying to raise $36,000 on his own because there's no program in place. Cancer patient number 2, another $30,000. Cancer patients 3, 4, 5, and 6, $170,000. Cancer patient number 7, and these are breast cancer patients, another $36,000, for a total of just breast cancer alone, $272,100. That's what he's trying to raise on his own. Mickey, stand up, let them see you. But that's not the end of it, because there's a throat cancer patient for which Mickey is also raising another $36,000. A brain tumor cancer patient, he's raising $216,000 for that patient. When you add all those together, that's up to $632,000. He alone is out there trying to raise. And then there's a 5-year-old in Nevis. After almost 2 years of treatments, the young boy will complete his chemotherapy treatment in early March. And he says he has only raised minimal funds for that treatment. And indeed, he wants to raise another $99,900 just to complete that 5-year-old's cancer treatment. When you put it all together, Mickey on his own is out there raising $763,400 to help some 12 or 13 patients stricken with cancer. Mickey, I have to ask you to stand again. And so, the Commission, my good friends, is comprised of a number of persons. I'm not sure if all of them are here. But the Commission is headed by Ms. Azilot Clark, who started about a year and a half ago on this work with us. And it includes, of course, persons from the Chamber, like Brenda John, from the Ministry of Finance, Calvin Edwards, from the Insurance Fraternity, Gary De Silva, from our Nevis Island, sister island, Nicole Slack, Permanent Secretary in Health, Dr. Cardell Rollins of Nevis, Malvi James, also of the Chamber, Tashna Powell from our legal department at the government headquarters, Delara McLeod-Taylor, Dr. Charles Warner, Dr. Cameron Wilkerson, Andrew Skerritt, Elvin Bailey, and of course our Chief Medical Officer, Dr. Hazel Laws. My Permanent Secretary, Mr. Edwards, is an ex officio member of that committee. Could you stand if you're here so that we can recognize you? And of course, we have in our office Mr. Clifford Griffin, who has been the focal point for all that is happening here this week and continuing on this program. Now, some far-reaching decisions about the design of universal health have to be taken. In order to do that, the Commission would be assisted in its work by a team from the University of the West Indies Health Economics Unit, based in Trinidad and Tobago. There are some members of the team who are here, and I would like you all to stand and also be recognized. They have been contracted by the government to partner with us on this journey. It is a contract based on a proposal presented to us and approved by the Cabinet. And we are grateful. We are grateful for the support from regional partners such as PAHO, and you heard from Dr. Etienne, and also from the government of the BVI, who I understand have representatives here. Could you also stand, my brother? I think we also have someone from the Social Security program in BVI as well. Yes, you stood already. We shall learn from their collective expertise and experiences. Now, government recognizes and also welcomes and applauds private insurance in the marketplace. But government understands that not everyone has the wherewithal to access it. Therefore, the need to ensure that everyone obtains some access. It is now the government's duty, and we take the responsibility to pass legislation to ensure minimum standards of health insurance excellence in the Federation, and that all persons have adequate coverage, regardless of income, regardless of national origin, or even, in fact, and pre-existing conditions. Oh, how good it will be when there is no out-of-pocket payment at the point of service except where co-payment is predetermined. Oh, how good it will be when there's no co-payment for preventative services, such as vaccinations, pap smears, prostate health, breast screening health, colon screening health, and other checkups. Ultimately, though, where the rubber meets the road, there are always questions. What is the full range of services to be covered under the Universal Health Program? How much is the Universal Health likely to cost by 2020, 2025, 2030? How will the nation mobilize the funds to pay for universal coverage? How will the operations of universal health insurance be managed? How will it be coordinated and audited? On these questions and others, I expect sound advice from the Commission. I expect sound advice from not only the Commission, but its partners, and also from the general public. Following the receipt of this advice, it will be my duty, my responsibility, to take the Universal Health Blueprint to the Cabinet of my government, and then ultimately to Parliament. As I wrap up then, it bears reiterating that there is clear justification for universal health insurance in our federation. Because I know we can all agree to a vision of barrier-free and bankruptcy-free health services of high quality. I know we can agree also that pooling the resources provide a better opportunity for achieving the desired health results. And I'm also confident that persons of all political persuasions agree that government must play a pivotal role if we are to achieve these results. It is in that vein that I reiterate that good health is a vital ingredient to national resilience and sustained development. Therefore, high-quality healthcare services must be accessible to all without discrimination. We must not shy away from a contributory model. Just like Social Security, health security must be adequately resourced and protected at all costs. It is also in that context that I say that universal health insurance is not a divisive instrument, not divisive on the basis of ideology or party politics. Therefore, I am today extending a hand of solidarity and collegiality to the parliamentary opposition and all opposition. We who are representatives of the people must lead so that the strongest possible universal health program is designed, resourced, and implemented. Our people are depending on all of us to get it right. And I fully expect us to work together to get it right. I therefore look forward, dear Commission, to the report in short order. May your deliberations and public consultations proceed with speed, but with the expected thoroughness. Proceed with evidence-based discourse, and proceed with the full participation of every facet of our community. Best wishes. Thank you.
Stay up to date with news, programs, and activities of the government with SKNIS. Like us on Facebook. Listen to us on SoundCloud. Follow us on Twitter. And watch our videos on YouTube. Connect with us today. SKNIS, St. Kitts and Nevis Information Service.